Hello, good evening everyone, and welcome to 365 Live. My name is Kamin, and I will be the host for tonight's live session. A gentle reminder that all information shared at this event by the speaker and 365 CPS is for general information only. Do consult your doctor for personalized and detailed medical advice. All right, so without further ado, I am pleased to introduce tonight's speaker, Dr. Lee Kaiman, a consultant radiation oncologist at Farrer Park Hospital. Dr. Lee is a practicing radiation oncologist with about 30 years of clinical experience. He received training in the UK and US and has been treating patients with advanced radiotherapy techniques. So prior to joining Farrer Park Hospital, Dr. Lee was a senior consultant, head of department, and acting director clinical at the National University Cancer Institute (NCIS), and he is currently a visiting consultant at National University Singapore (NUH). So he holds leadership appointments in professional and academic bodies in radiation oncology. So tonight, Dr. Lee will be sharing with us more about the importance of cancer prevention and early detection. Okay, hi Dr. Lee, we're
Can you hear
happy
me
to
now?
have you tonight to share your knowledge with everyone. So without further ado, let me hand over the time over to you, Dr. Lee. Thank you.
Okay. Hi, everyone. Thanks for coming on this Saturday evening, tuning in for this talk. I'm sure that those of you who are here have got some personal interest in this topic, as well as those who may just would like to have a general awareness of cancer prevention and early detection. As I alluded to earlier, cancer is often an interesting topic that hogs the headlines. This is just a sample of the Google search this week I just did while preparing for this talk. And you can see that on the left-hand side, there are various headlines on cancer in the international media, the Daily Mail, BBC, Fox News. And then on the right-hand side, local news, some news on local well-known people, celebrities, all cancer-related. So it is a fascinating topic. It is also a sobering topic. And for the purpose of this talk, I'd just like to touch on a few key points. On the left, I suppose the question that we all have is, so given the seriousness of cancer, is this preventable? And if it isn't, then is it curable, right? So in the course of this sharing over the next 20 minutes or so, I'd like to talk about what cancer is, how does it affect us, how common is this, the incidence and the trends, especially in Singapore, what are the possible causes, and therefore understanding these, how do we prevent cancer, right? And then what are the programs available that help us to screen for these cancers and detect it early? And then I'll just quickly summarize. So getting into the meat of the sharing, this is a slide on the various cancer presentations that we see in the clinic. On the top left, you see an X-ray, a plain X-ray of the lungs, and you can make out the shadow on the left lower lung, just next to the heart. This is obviously lung cancer that is seen on an X-ray. The patient may or may not have symptoms. It could well present in the form of a pre-employment X-ray, to the shock and surprise of the patient and the loved ones. And then lower down, you see below that, you see the scope picture of a cancer in the colon. It looks nasty. This patient probably had symptoms like bleeding, constipation, change in bowel habits, and this is what you see on a scope. And then right in the middle, you see the MRI picture of a patient with advanced cancer involving the brain. So you see all these multiple spots picked up on MRI in the brain. And then on the right-hand side, you see a PET scan picture of cancer that's disseminated throughout the body. You can see all these dark spots up in the neck, down to the spine, mainly in the bone, mainly involving the bones, the pelvic bones on the side as well, as you can see. So cancer can present in different forms, different shapes and sizes when they come to see us at the clinic. But regardless of how it presents, there's a bit of biology as to how it actually gets started, how it originates. So it all begins in a genetic change, right? Right at the bottom left corner, where an abnormality, one of the genes, just undergo a certain change, whereby it then affects the behavior of a cell. So that cell is genetically changed such that it becomes more active. It multiplies in an uncontrolled fashion to form a bit of a clump, all right? And then with further change, it forms swelling, and then it becomes a mass that is apparent on the surface of the skin. And then later on, it can then invade deeper structures, especially blood vessels, lymphatics. Then that's when then it spreads, or what we call metastasizes, to other parts of the body. So all cancers, regardless of which site, how it presents, as you saw just now, begins with the one cellular event, one genetic event, and then involving the rest of the tissues, the rest of the organ, and the rest of the body. So with that kind of presentation, what is the size of the problem in the world? All right. So according to this set of statistics, there are about 20 million new cases detected worldwide every year. This is in 2018, involving about 10 million deaths, all right, or 1 in 6 deaths worldwide. The most common cancers in the world would be, some of you would be familiar, lung, breast, colorectal, prostate, skin cancers, and stomach. And this accounts for the more common cancer deaths involving the lungs, colorectal, stomach, liver, and breast. So this is the global picture. This is a local slide that shows that in cancer, in Singapore, all right, there is, in fact, you can appreciate a doubling of the incidence over this period from 1997 to 2015. Essentially a doubling from about 6,000 plus to about 12,000 plus. And this is largely contributed by the fact that, as everybody knows, that we are a super aging society, all right? And these are the more detailed stats. Just look at the right-hand side without going through to all the figures. So over the last 50 years, this is updated in 2022, there has been a 3 to 4 times increase in the incidence of cancer over the last 50 years of our nationhood. We are SG60 this year. So over 50 years, 3 to 4 times increase. And that translates into a 1 in 4 lifetime risk of developing a cancer in all of us. All right, so that's the local stats. And if you drill down deeper into what kind of cancers we see, all right, this is a figure, this is taken from the NCC website, actually, 2017 to 2021. The most common cancer in men is actually prostate cancer. And then the most common in women all along has been breast and remains to be so. The top 3, men, prostate, colorectal, lung, all right? And then for women, breast, colorectal, and lung. So, what causes cancer? The main takeaway from this slide is that while we talk about the genes, while I mentioned the genetic event just now, every cancer starts off with a gene, but the actual risk of developing a hereditary cancer, that means something that's passed down through the genes, via the genes from the parents and ancestors, is only about 5 to 10%. In other words, the vast majority of cancers presenting are actually spontaneous due to the combined effects of tobacco, alcohol, diet, obesity, infections, and some environmental factors, all right? So the most common is tobacco. I'll make mention more of that afterwards. So the main takeaway from this slide is that the vast majority of cancers are actually caused by lifestyle, by environment, by habits, and all that. Whereas only about 5 to 10% are actually passed down, all right, from parents to child, even though every cancer event is a genetic event. So if you go down to the each possible cause, tobacco is the main culprit, right? It's been estimated that a smoke-free environment can actually prevent 15 types of cancer. All right, the main cancers affected, as we all know, lung. All right, but that's not the only one. Others are like bladder, bowel, pancreas, and then the esophagus, head and neck cancers. Quite a lot of cancers affected by smoking. And the reason is that in each stick of a cigarette, there's a vast amount of chemicals that are all carcinogenic. All right, these are chemicals, these are stuff that are actually seen in batteries, in candle wax, in lighters, industrial solvents, insecticides, toilet cleaners, and the rest. All right, so each cigarette stick actually carries a huge amount of carcinogenic chemicals. All right, and it's been shown in this. I think this is a stat many years back that showed that the incidence of cancer actually corresponds to the smoking habits that's traced over the years. So there's a 20-year lag. So if the smoking trend in a certain population rises over a number of years, 20 years later, you see a corresponding increase in the cancer incidence. So that's the data for tobacco is very convincing. All right, rock solid. Next culprit, actually not far off, is alcohol. Alcohol can cause about 13,000 different types of 13,000 cancer cases per year in the UK. All right, and the main sites affected are bowel, breast, again esophagus, head and neck, mouth area. All right, and the American Cancer Research Institute actually have made a recommendation, obvious one, that for cancer prevention is not to drink alcohol. I suppose that's a tall order for any society, for any country. So the more practical recommendations to control alcohol consumption because of all the statistics. All right. Earlier, tobacco, no recommendation here, but my takeaway message is try not to smoke. All right. If we can, this one, I think we can do with some resolve. This one, alcohol, probably needs a bit of discipline, and that should be okay if you are mindful of that. And then next, this is the one that's tough, diet, right? Diet, as you see on this slide, causes about 35% of all cancers. It has a 35% influence. And the main ones affected, you can see, will be colorectal cancer, pancreatic cancer, even breast cancer, and uterine cancer in females. Interestingly, prostate cancer, this catches me by surprise. Prostate cancer, as we heard earlier, is very common in men, but I'm just a bit surprised that actually there's such a high correlation with diet. All right. Recommendation by the same research institute to eat diet rich in whole grains, vegetables, fruits, and beans. Limit consumption of red and processed meat. Again, a tall order to cut this off completely unless you are vegetarian. And then to limit consumption of sugar and sweetened drinks. All right, so these are the recommendations set forth. This one, obesity and cancer. All right, again, these are UK statistics. Obesity is reported to account for a wide range of cancers, namely bowel, kidney, breast, esophagus, again, and women uterus. All right. Again, recommendations to limit consumption of fast foods, processed foods, high in fat, starches, or sugars. Keep a healthy weight and exercise, physical activity. Apart from lifestyle, all right, there are bugs out there that can cause infection that leads to cancer, all right? The main culprits are the common ones on the right. Liver can cause hepatitis B, hepatitis C can cause liver cancer. HPV, human papilloma virus, well known to be associated with cervical cancer in women. And then EBV, Epstein-Barr virus, well known to be associated with nasopharyngeal cancer, or NPC, which is common in this part of the world. If you look at the diagram, there are other cancers. I mentioned HPV, Hep B, Hep C. There is this H. pylori, which is found in stomach. And then there is HIV, of course, causing lymphoma in the immunodeficient patient. EBV, again, causes lymphoma as well as NPC. And some of the rest, all right? So infections is one of the well-known, well-described cause of cancers. Environment, in general, background factors can be helped at times. So there is background radiation, is UV rays all around us, but thankfully all in controlled measure. But all of them has been studied and researched to be of some influence in cancer causation. Thankfully, this is not a major problem unless you happen to be working in an environment where there's a high risk of radiation. UV rays, I suppose, especially in Caucasians, where they are more susceptible to skin cancers, melanomas. For Asians, somehow we are more protected because of skin pigment. Okay, this is another takeaway slide. It's been found that actually cancers can be prevented, and to quite a considerable extent, all right, up to 40% or 40% of the cancers that we see in the clinic are actually avoidable, are actually preventable because of all the causes that I mentioned, where something can be done about it. For example, smoking, obesity, alcohol, again, UV, if we put on, if we can avoid sun tanning as much as possible, put on skin protectors, if we get involved in physical activity, exercise, if we are more controlled with our diet, we can actually, a combination of all this can actually translate into a 40% prevention of cancer. That's not bad, actually, to actually reduce cancer rates by 40% simply by working on a lifestyle, simply by paying attention to some of these causes, which we can do something about. All right, so this is I think it's a heartening takeaway slide. Okay, what are the cancers that we can't avoid if we are born with the genes, right? So as I said, thankfully, this affects only 5 to 10% of the cancers that we see. Some of the well-known genes, you may have heard about them, BRCA1 and BRCA2 genes affecting women, breast cancers and ovarian cancers, and also involving men, causing prostate and men's breast cancer. All right, these are the well-described ones. Quite high incidence if you're affected by the genes. And then this one, FAP, familial adenopolyposis, affecting colon cancers. They begin with multiple benign polyps in the bowel at young age, and almost 100%, all of them eventually develops into a cancer by age 40. This is quite significant. And the last one, Lynch syndrome, also causing bowel cancer if these genes are present, about 70 to 80% risk by age 50, and also affecting other cancer types. So these are the can't be helps. If one is unfortunately in that 5 to 10% that are born with these genes, then you are in the high risk group. We are in the high risk group, and something needs to be done. All right, talk a bit more about that. But for the rest, in general population, I mentioned this earlier, just for a reiteration, some lifestyle adjustments with regards to tobacco, alcohol, obesity, diet, exercise can reduce cancer by 40%. Where there are cancers that are caused by infections, I mentioned some of them, some vaccinations are available. You can take advantage of these programs to reduce our risk of developing those cancers. And then for the hereditary cancers, those that we are born with, there are counseling to detect them early, or better still, to do preventive surgery even before they come on. All right. Now, for example, in ladies with BRCA1 and 2 genes, whereby something can be done to prevent breast and ovarian cancers. All right. For the other thing that we can do for everyone is actually to screen for some of these cancers, all right, so that we can detect them at an early or even a pre-cancerous stage, whereby something can be done with good results, all right. And this applies to two groups of people: the general public, those at average risk, that would be the majority of us, and that high-risk group, that 5 to 10%, that needs to be more vigilant, more attentive and intentional to prevent cancer from developing, all right? And thankfully in Singapore, this is a bit of an election kind of a message, but we are actually quite privileged to have a very comprehensive cancer screening program led by the Ministry of Health, involving agencies like Singapore Cancer Society, Health Promotion Board, whereby there are some well-developed cancer screening programs such as mammograms for breast cancer, pap tests for cervical cancer, and then HPV tests also for cervical cancers in older women, and fecal blood tests for colorectal cancers. All right. So these are the cancers that are these are the screening methods and the respective cancers that are well studied and are recommended. So we can also correlate this with the different age group. For example, women above age 25 should go for their pap smears. And then if you're older than that, you can also go for pap smear or the HPV test. In fact, the HPV test is recommended after 30. And then for older men and women, you can go for, again, breast cancer for women, and then colorectal cancer for both men and women. All right, so quite available out there, quite accessible, and some of them are actually offered free. Like, for example, this is off the Singapore Cancer Society website. At no cost, screening programs are offered. Again, mammogram for breast cancer for women, pap smear for younger women, and then a HPV test for women above 30 years, and again, fecal occult blood tests for colorectal cancers for men and women 50 years and above. All right. So as I said, very available, very accessible screening programs to detect cancers early in Singapore. So just a few slides to show how each is done. Cervical cancer, basically a pap smear. You can see on this left side, MRI of a normal womb, normal uterus, the side view. All right, this is the back, this is the front, this is the bladder, the urine inside. So it's a normal looking uterus. All right, so the pap smear involved scraping the cells at the tip of the cervix from the bottom around this area here. All right, to remove some cells for study. All right, so if it is a normal cervix, it looks like that. And early stage, a bit of thickening, mid stage, and then an obvious cancer, an ulceration. All right, and on MRI, it will look something like that. You see this mass down here, as compared with a normal looking uterus with the canal in the uterine canal in the center. All right. So that's cervical cancer. And as I said, for younger women, a pap smear is recommended. For older women, 30 years and above, a HPV test, very much the procedure is quite the same, but there's a different test that's involved. And this one needs to be done just once in every 5 years to screen for cervical cancer. Then Also, I mentioned that cervical cancer is correlated to HPV infection. So HPV vaccination program is also available. All right, there are two types of vaccines covering the main strains of HPV that causes cancer. The specific indications are there. They are both approved for use for different age groups, female 9 to 14, 15 to 25. But it is there. Just HPV vaccination is available in Singapore for prevention of cervical cancer. So this one is breast cancer, mammogram, quite common. You see the pictures here, normal, and then a cyst being formed and a cancer. So there are different sort of stages that are being picked up. What would be the most important finding is those that are early, just suspicious, whereby the probability of cancer is actually is quite a wide range from 2 to 95%. So this is the group that will benefit most from breast cancer screening because the cancer is probably physically, clinically undetectable except for mammogram, where there's a risk of 2 to 95%, where a biopsy is considered. All right. The rest, the more obvious ones, you probably can feel a lump, all right, and then you can go straight for a biopsy. Or if it is so early, then actually there is no cancer, but nonetheless, to have that peace of mind with a normal mammogram. Colorectal cancer, I mentioned that you can do the fecal occult blood test that can be done every year at the age of 50. For the average risk, all right, a colonoscopy is also recommended every 5 to 10 years. But if there's increased risk, for example, if there's family history, there's that genetic background, the predisposition that I mentioned, then then a more intensive, a more frequent screening or colonoscopy is recommended. Actually, annually, all right, every 1 to 2 years. And for certain high-risk groups, again, whether it's your lifestyle, smoker, smoke heavy, active or passive smoking environment, all right, or if there's background of hepatitis, then these cancers are relevant. Liver cancer, lung cancer, you can go for these screening modalities available, like the blood test, serum AFP, or liver ultrasound every 6 monthly. For smokers, a low-dose CT lung that's available now. For NPCs, nasopharyngeal, if there's a family history, first degree, then again, screening is recommended on a yearly basis. Go for the blood test for the virus as well as a scope. Prostate cancers, you can go for quite easily done PSA screening, just a blood test. All right, if you think you're high risk, especially if there's a first degree relative who has this. In summary, then, this will be my last slide. Cancer is a leading healthcare problem requiring serious attention. Prevention is possible. That's the good news. All right. Lifestyle adjustments, vaccinations, genetic counseling for those in the high-risk group. And that's because screening is effective for early detection and better cure rates for general publics as well as high-risk groups. With that, I thank you for your kind attention. Happy to take any questions.
All right, thank you, Dr. Lee, for your comprehensive and informative sharing. I've also learned a lot from your sharing. And for those who have just tuned in, a gentle reminder I'd like to share again. If you have any questions, please feel free to share in the comments and we will invite Dr. Lee to address them accordingly. Right, while you are typing your questions, let me start the ball rolling and ask Dr. Lee this question. So actually, Dr. Lee has mentioned that diet plays a huge part with regards to cancer. Is a huge high percentage of 35%, and his advice is to reduce sugar-rich drinks. So are there any specific foods which one should eat more or eat less? Maybe Dr. Lee, you can share with those who are tuning in at the moment.
Yeah, that's a common question. Unfortunately, as far as I know, there's no specific prescription for what is a cancer-free diet. So the general advice is, as from the slides I presented, is you can sort of gather that a balanced diet, avoiding the extremes of eating mainly meat, especially red meat, drinking very sweet kind of drinks, um, and then animal fat again. So I think it's hard to avoid all this completely, but if taken in moderation, even alcohol, right? Even though the American, as I said, the Research Institute suggested that maybe you should take zero amount of alcohol, but again, in the real world, it's difficult. But if you are more mindful and more disciplined about it, then we can actually overall reduce our risk of cancer up to, as I said, up to 40%. All right. As to exactly what is the restriction, how much alcohol can be taken, how much sugar can be taken, I I think there are probably some guides out there if we speak to a dietitian, but I'm afraid I'm not able to give those specific prescriptions.
Thank you, Dr. Lee. Actually, he has also kindly answered the second question which I wanted to ask. So actually, Dr. Lee mentioned that more than 40% of cancer cases can be prevented and is avoidable. So he mentioned that simply by working on lifestyle and working on causes which we can actually make a difference lah. So the question was actually about drinking alcohol. So the question actually I wanted to ask, so alcohol is linked to increased risk of cancer. So is it okay to drink alcohol moderately? Yeah. So Dr. Lee, you actually shared that um, if we speak to a dietitian, maybe there are certain guidelines and rules about alcohol drinking, right?
Yeah, so obviously all I can say is to avoid binges lah, to avoid alcohol, regular alcohol binge. But what constitutes moderate drinking, right? What is one glass a day okay? I'm afraid I have not read up on that for a specific answer. Admittedly, I can urge that we be mindful that that if we can avoid it, we should try to avoid. Yeah, and to yeah, just keep it in balance and in a disciplined way.
So having a balanced diet, taking food in moderation, is actually very crucial in our daily lifestyle. So thank you, Dr. Lee. Next question. Um, there is actually okay, a question. What at what age should men check for prostate cancer?
I would say again, I don't think there is a fixed recommendation for prostate cancers. If in general, I'll say 60 and above, that's when that's when the incidence of any cancer actually starts to go up for both men and women. So PSA blood test for prostate cancer is easily done as part of a battery of tests for other things, for diabetes and cholesterol and all that. So I think it can well be included if you're 60 and above. But if it has family history and all that, maybe younger, maybe 50, yeah. But for average risk, I think if you're going for your normal healthcare screening, they would normally include a PSA as well.
Okay. So for those of you who have missed the earlier part of the sharing, uh, maybe Dr. Lee can share with everyone currently tuning into the live stream. Lah. So for example, like what is the general recommended age for individuals to start going for cancer screening? So just now Dr. Lee mentioned uh, as early as possible, if I recall correctly.
So I think if you go by local authorities, MOH or HPV guidelines for women at the age of 25, you can start going for pap smears. Pap smears. Then at 30 and above, you can also go for pap smear. This is to detect for HPV, not just to read the cells. And that's once every 5 years. Then for breast cancer, 50 and above, unless, again, if There is family history, a bit more worried. Then at 40, that's also allowed for, but I think the general recommendation is 50 and above for mammogram. Then again for colorectal, 50 and above for both genders. So these are the well described, well researched recommendations that are adopted by MOH and HPBs and Singapore Cancer Society.
We have a follow-up question. Can CT scan be a preventive measure to screen for cancer?
Not across the board, but certainly, I think I made mention in one of my slides that for patients who are at risk of lung cancer, so if you are a known smoker or you live in an environment of heavy passive smoking, then or there's family history of lung cancer, then there is this low dose CT that's available. Where the problem with CT is that it contains radiation. It has ionizing radiation, and that itself, ironically, what is used to detect and to manage cancers, the radiation that is used in the very modality itself, ironically, can cause cancer over a period of time accumulatively. So it's been, in fact, I think there was a recent write-up in China News Asia about balancing the cost effectiveness of how regular, how frequent to do CT scans for the benefit versus the cancer, the risk of developing a carcinogenic effect of ionizing radiation. So I don't know what I answered your question. So yes, it's available, especially the low dose CT with a lower risk of carcinogenesis, and that's used mainly for lung cancers. For the rest of the body, because you need high dose CT, because the rest of the body, the tissues are thicker and all that. You cannot, for lung, it's because it's mainly air inside, so you can use low dose CT. But for tissues like liver, colon, and all that, where there's body tissues, then you can't get away with the low dose CT, it has to be high dose CT. And then that question of balancing the risk benefit comes into play.
Okay. I'm currently looking at the questions on the floor. So I think we have answered the question for male at age 66, what kind of scans will be recommended and how often to be done. I think Dr. Lee has already mentioned just now. Probably he has missed the earlier part of the answers. Okay. He says he supposed the most common ones are PSA, colonoscopy, and injection of HPV.
Yes. Injection of HPV is more for prevention of cervical cancers for younger women. Yeah. So you're talking about a male at age of 60 and above. Yes, PSA, colonoscopy.
And for the females, I think we have a question about why isn't ultrasound not fully promoted together with mammogram?
It is actually, it is. Usually both are done together, but you're saying that the payment part, isn't it? Okay, that one I got no comments because I, yeah. So, very often my patients come with both a mammogram and an ultrasound done at the same time. As to whether they pay for both or it is paid for by insurance for both or either, I'm not sure. But not uncommon for patients to have both done at the same time. I think it does enhance the result, the accuracy to have both done rather than one or the other.
So this could probably be a one-off issue, I guess. Okay, the next question: how can we be more proactive in recognizing early warning signs and symptoms of various cancers that may not be part of the standard screening programs?
Okay, that will. So it's very generic. So as I made mention just now, very early on in slides, cancer is indeed a problem, and it affects various sites, different sites. So and different sites will have different signs and symptoms. Certainly, this is the actually this will this is the material for another talk altogether. So yeah, but in general, right? So if there's abnormal swelling, abnormal lumps and bumps in any part of the body, abnormal bleeding, abnormal change of bowel habit, abnormal cough that doesn't go away. So it's wide ranging. So anything that it's not supposed to be there, but in recent days, recent weeks, or recent months, it doesn't go away, or it gets worse, or then those are telltale signs that this could possibly be cancer. But not to alarm anybody, it may not be as well. And in terms of standard screening programs, these are based on research and studies, trials that are done uh, over thousands of patients worldwide as to what gives the best yield. You don't have to have a test that is overly sensitive, where you pick up a lot of false positive, and you send a lot of anxiety and fear, and subject patients to follow-up tests, all right, which sometimes carry risk of on its own, infection, bleeding, and all that, from scopes and all that. So we only want to do these where it is necessary, where there's a high chance of picking up something, like the mammogram, the chart that I show you, where there's a 5 to 95% chance of picking up something based on the test alone. Otherwise, you missed it, and that would be the best return for a standard screening program. So while many things can be done for many different tumors, but again, the yield may be quite questionable. You see, you can get confusing results, conflicting results, which may cause a lot of anxiety, but may not necessarily benefit the individual patient.
So I guess the bottom line will be to test for to go for regular screenings, and then to be more observant in case there are some early warning signs. So we have a follow-up question on this. So does thickening of lining on the uterus means cancer?
Doesn't necessarily mean so, but it warrants a check. So, especially again, as I said just now, if it wasn't there earlier in the previous scan, if it's something that's recent and it is getting worse, getting thicker, then certainly it warrants a check. The gynecologist can actually put a scope in to have a look. Okay, they can do what you call dilatation and curettage to remove some cells, just like a pap smear from the cervix, but this one go deeper into the uterine cavity to remove some cells from the inner lining, and then look at the cells to make sure there's not cancer. So the answer to that is, if the thickening is new, then yeah, then it should be looked at. Why has it developed? Hopefully, it's not anything sinister, but it should be actively looked at to ensure that it isn't.
All right, I have a follow-up question for Dr. Lee. So may I check with you, how reliable are self-examinations when it comes to early detection?
Again, depending on which cancer type, for breast cancer, it's highly recommended. Actually, it's highly recommended. Again, if you feel something that you're quite sure that it wasn't there before, you know, then it warrants a further check with a mammogram or ultrasound or that. But self-examination is easily done. It's easily done in privacy of your own home, in your own shower, and and if you do find something that most of the time it is not something worrying, but it is worth checking it out. So for breast cancer, I'll say yes, self-examination has got a major role. For the rest, I suppose a bit difficult to actually feel for internal organs, but in the neck region, for example, neck region, if there's lumps and bumps, lymph node swelling on one side, if you look yourself in the mirror, then suddenly you sort of find, hey, how come my one side of the neck is seems to be fatter than the other side, again, most of the time it may not be anything, but if it persists, then it's worthwhile checking out. It could be a lymph node from a cancer from the head and neck region, the nose, and all that. And then again in the mouth, right? If then the mouth is all along eating, swallowing okay, then after a while you notice, hey, there's something seems to be a bulge inside that seems to affect your eating, your swallowing, maybe an ulcer that cause some pain. Again, worthwhile to have it looked at if it doesn't go away after a few days.
So I guess Dr. Lee has also answered the next question that I wanted to ask. So for those with vague or persistent symptoms that aren't typically associated with cancer, what is the best course of action to pursue further investigation?
See a doctor.
Yeah.
I think go see a GP first. Go and see your familiar, friendly doctor, and you should be able to at least have a first-hand screening as to what it is. And then, as I said, most of the time it is not. But let the doctor tell you that. Let the doctor, because he would be seeing this more than each of any layman would, right? So once he picks it up, then he will send for further relevant tests, whether it's a mammogram, whether it's a scope, or whether it's a CT scan, right? Depending on the site that's involved. But if he thinks that no, this is quite common, he sees in other patients that come by, then at least you get that peace of mind that this is not something untoward.
All right, thank you, Dr. Lee. So for those who have just tuned in, if you have any questions, please feel free to type in the comments, and we will invite Dr. Lee to actually address them accordingly. So far we have answered most of the almost all of the questions in the comments box below. I have a follow-up questions. I wanted to check with Dr. Lee. Does radiation cause cancer, and what are some of the long-term effects of radiation exposure?
Okay, so this is very much in my domain because I actually give radiation to treat cancers. But one of the caution that I give patients is the fact that it is well known that radiation actually can cause cancer. We use radiation quite a bit in the hospital, as everybody knows. We use it for X-ray, we use it in CT scan, fluoroscopy, and I use it to treat cancers. But it is a known fact that any form of radiation, whether it's the diagnostic type or the therapeutic type, does carry in itself a well-known risk of cancer causation many years down the road. It doesn't happen overnight. It takes years, usually 10, 20 years, 30 years. So depending on the age group of the patient, depending on how much radiation is received, depending on the sites of the radiation, there is a definite, usually small risk of cancer at the site that received the radiation. So the answer is yes. But to put it in perspective, before we offer the radiation, before they do the radiation, we ourselves as clinicians must be convinced that the benefit of that procedure far outweighs the risk of causing a cancer. The risk is there, it's not zero, all right, but we have to balance that versus the risk of not doing that procedure. What happens if we miss that cancer that's already there and it's not picked up by X-ray? Yeah, this is very much my territory in the sense that I use radiation to treat cancers, right? But before I give the radiation, I offer the radiation to any patient. I actually make a point during the informed consent process, to explain that actually the very radiation that I'm giving can also cause a cancer years down the road. But the risk of that happening is far, far offset by the fact that if I don't give that radiation, if the patient doesn't receive the radiation, the cancer that the patient already has can do a lot more harm. So it is, again, a risk-benefit balance. And I, as the clinician, I, as the radiation oncologist, must be convinced myself that the benefit of offering the radiation far outweighs the, the risk of it potentially causing a cancer many years down the road. So that risk is usually very small, and the risk of the cancer that the patient is already diagnosed with causing harm, causing problems, far outweighs that. So yeah, so it is a balance. It is a balance, but we have to be convinced that the risk benefit trade off is worthwhile taking, and then we offer it to the patient. Likewise, actually, the same with doing a mammogram or a scan. You probably heard of PET scans, uh, whole body scans, and all that. Any form of scans, with the exception of ultrasound and MRI, any other form of scans actually carries ionizing radiation that can cause cancer. So as to how frequent we use it, how much dose we give, I mentioned just now about low dose CT scan for lung cancer. The whole idea is that we want to give the minimum dose, the minimum radiation, in return for the benefit of picking up a tumor or treating the tumor with the radiation. So yeah, so at the end of the day, as I said, it's that trade-off, it's the risk-benefit trade-off that we have to be convinced about, and then we offer and explain that to the patients.
All right, thank you, Dr. Lee. Okay, so I guess I'll have to round up the session for tonight. Uh, so I would like to share like two pointers that I learned from Dr. Lee's sharing today. So more than 40% of cancer cases can actually be prevented and avoidable. So working on our lifestyle and having a balanced diet and taking food in moderation does actually help. And then and it's generally is recommended to go for cancer screenings early, and if you noticed anything that hasn't been around in the body, it's better to go and check it out. Yeah. So anything that you would like to add on, Dr. Lee, from your end?
I think there was a question about screening for other types of cancers. Yeah, I wanted to sort of reinforce just now that there are very good screening programs available out there, low cost, even no cost. As I said, this sounds like elections pitch, but Singaporeans are actually blessed to have all this available and accessible, either provided by MOH or HPB or Singapore Cancer Society, or even 365 Live, right? You have a range of cancer prevention screening programs. So take advantage of all this. Yeah, because everything is so nearby. You don't have to travel, miles to. Everything's very nearby. It's just a trip, an MRT trip, and then you away and you can get it done, and then you have the peace of mind. And these are the standard recommendations based on research and studies that have been done worldwide, which gives the best return in terms of yield and pickup rate and all that for that procedure to be done. Then there are others which are less established. These are not standard recommendations, but by all means, if you think that you're at risk for that particular cancer and you belong to the age group that are at high risk of getting cancer, and by that I think in general, anyone that's 60, 65 and above, you should inquire about a test with your friendly doctor, and then he can make the arrangements for you. We have all the procedures available in Singapore. Actually, we are, as I said, we are quite well equipped. So take advantage of it if you like to make inquiries and like to find out more.
All right. So thank you, Dr. Lee, for your sharing, and thank you everyone for your questions. Now it's time for Dr. Lee to take his leave. So thank you once again for sharing your professional insights. I'm sure everyone who has tuned into the live stream have benefited from your sharing tonight. Thank you so much, Dr. Lee. See you.
Thank you. Thanks, everyone. Good night.
All right. So Please do like, share, and follow us on our social media pages for the latest updates on our events. Once again, thank you so much for joining us tonight. I hope to see you all in the next session. Take care, stay healthy, and good night.